Have you ever wondered why, as you get older, it becomes harder to stand up from a chair, your legs hesitate when stepping up a stair, or after walking for a while your back feels tired and your knees start to ache, even though you still walk every day? Many people believe this is simply due to aging. That after 50 or 60, the body naturally weakens, and this is just normal. But as someone who has worked in health for many years, I want to tell you something very important. Many movement problems after 50 are not caused by age itself, but by one group of muscles that has been forgotten. Hello, my name is Dr. James Anderson. Today, we are going to talk about a medical truth that very few people over 50 have ever had clearly explained to them. The glute muscles, the foundation of body strength, are quietly getting weaker, often without you realizing it. Let me put this simply. The glute muscles are not just for sitting. They are the largest and strongest muscle group in the body, responsible for standing upright, walking steadily, going up and down stairs, standing up from a chair, keeping balance when you slip or turn suddenly. When your glute muscles are strong, your body is supported from the ground up. When they are weak, the load is pushed onto your lower back, knees, and hips. And this leads us to the first cause, very common, but rarely noticed. Cause number 1, walking is good, but walking alone is not enough. For decades, people over 50 have been told, just walk regularly. It's the safest thing you can do. Walking is indeed good for your heart, breathing, and mental health. But research from the University of Waterloo shows that walking activates only about 30 to 35% of the glute muscles. This means more than 2/3 of your glute strength is not being used at all. Muscles follow a very clear rule in human physiology. If you don't use them, they become weaker. You are still moving. You are still walking every day. But your glute muscles are not getting enough signal to stay strong. Over time, they slowly fall asleep. And when the glute muscles fall asleep, the body looks for other ways to compensate. Cause number 2, the lower back and knees are forced to do work that is not meant for them. When the glute muscles are weak, what happens? The lower back has to strain more when you stand up. The knees take more pressure with every step. The hips lose stability when you shift your weight. At first, you may only notice a mild ache in the lower back, knee discomfort when climbing stairs, a feeling of unsteadiness when walking. But according to research published in the Journal of Orthopedic and Sports Physical Therapy, nearly 68% of chronic lower back pain cases in people over 50 are directly linked to weak or poorly activated glute muscles. This is not natural aging. It is the result of the body working the wrong way for many years. And the unfortunate part is this. Many people think they just need to be more careful. Walk slower. Move less. But the more you avoid movement, the weaker the glute muscles become. If you recognize yourself in what you have just heard, leave the number 1 in the comments below. And please share this video with someone you care about. They may be experiencing the same problem without understanding the real cause. I wish you strength and peace as you continue caring for your body. Next, I will share 2 lesser-known factors. The quiet signs that your glute muscles are weakening day by day, and the body's hidden physiological mechanism behind it. Before we talk about solutions, I would like you to pause for a moment. Not to worry, but to recognize the signals your body has been sending you for a long time. Many people over 50 come to see me and say, "Doctor, it must be because I'm getting old." But when we look more closely, the answer is often this. Not aging, but the body lacking the right support to function properly. Let's look at the most common symptoms of weakening glute muscles and why they happen. Symptom 1. Standing up from a chair is getting harder, even though your arms and legs seem fine. Have you noticed this? In the past, standing up felt natural. Now, you often have to push with your hands on the chair, put most of the effort into your knees, lean your body far forward to get up. This is not a sign of weak arms. It is a sign that your glute muscles are not strong enough to lift your body. In movement physiology, standing up from a chair is a classic test of glute strength. When the glute muscles are weak, the brain takes a detour and recruits the front thigh muscles, the knee joints, the lower back. You can still stand up, but your body pays the price with pain and fatigue. Symptom 2. Walking is fine, but stairs or higher steps make your legs feel shaky. Many people tell me, "I can walk without problems, but stairs make me feel weak." This is because walking needs only a small amount of glute strength. Stair climbing requires strong glute contraction and stable hips. When the glute muscles are weak, the hips lose alignment. The knees take uneven pressure. That shaky or hesitant feeling appears. This is an early sign of movement instability, a factor directly linked to fall risk after the age of 60. Symptom 3. Chronic lower back pain, even though scans show nothing serious. This is often the most confusing symptom. X-rays, MRI scans, nothing major found. Yet the pain remains. The reason lies in biological compensation. When the glute muscles are weak, the lower back muscles work overtime. The lumbar spine carries constant strain. The spine is being pulled instead of supported. According to the Journal of Orthopedic and Sports Physical Therapy, lower back pain caused by glute muscle dysfunction is very common, but often missed, because it is not structural damage, but a problem with how the body functions. Symptom 4. Changes in walking pattern, shorter, less steady steps. You may not notice it yourself, but family members often do. Your walking becomes shorter, more cautious, uneven from side to side. This is a sign that the side glute muscle, which stabilizes the pelvis, is weak and cannot keep balance when you shift weight from one leg to the other. And this point is very important. Research in aging shows that changes in walking pattern often appear 1 to 2 years before a fall occurs. What happens if this is not corrected early? If this continues, back pain becomes chronic. Knees and hips wear out faster. The risk of falls increases. Confidence in movement slowly disappears. But I want you to change how you see this. This is happening because I'm old. No. This is happening because your body is missing the muscle support it needs. Your body is not broken. It is simply not being activated in the right way. If you recognize one or more of these signs, leave the number 1 in the comments below. It tells me you are listening to your body. Next, I will show you how the body naturally responds and adapts, and the medical principles that allow you to safely reactivate your glute muscles after 50. In the previous section, you saw one thing very clearly. The problem is not your age. The problem is how your body is currently working. So the question becomes, after 50, can the body still adjust and recover? The scientific answer is yes, and often better than you expect. Muscles do not retire as you get older. They simply need the right signal, the right amount, and steady consistency. Core principle: reactivate, not force. For people over 50, the goal is not heavy exercise. The goal is to reduce inflammation and joint stress, rebalance how muscles share the work, restore the brain-muscle connection. When the glute muscles are activated properly, the lower back is relieved. The knees take load in the correct direction. The hips feel more stable when standing, walking, or turning. This is biological correction, not pushing your body to exhaustion. Method 1. Prioritize glute activation exercises. No heavy weights needed. Physiotherapy research shows that glute muscles respond very well to bodyweight exercises when done correctly. For example, hip lifts while lying down, glute bridge, gentle backward leg lifts, opening the knees while seated. These exercises put very little stress on the joints, are easy to control, help the brain remember that the glute muscles need to work. 2 to 3 sessions per week, about 15 to 20 minutes each, are enough to create real biological change. Method 2. Nutrition that supports muscle, especially protein and key nutrients. After 50, the body becomes less efficient at building muscle protein. This means too little protein leads to slower muscle recovery. Lack of key nutrients weakens nerve signals to the muscles. You do not need complicated diets. Just focus on enough protein at each meal, such as eggs, fish, beans, or lean meat. Magnesium and vitamin D to support muscle contraction and nerve function. Drinking enough water so muscles do not weaken. Eat stiff and tight. Glute muscles cannot become strong if the body lacks the basic building materials. Method 3. Walk smarter. Use walking as support, not as the only exercise. Walking is not wrong, but it should be used as a warm-up, a way to keep blood flowing, mental and emotional support, not as the only form of exercise. A simple but effective tip: take slightly longer steps. Push gently through your heel. Feel the glute muscle tighten as the back leg leaves the ground. This turns walking into gentle glute activation instead of just movement. Method 4. Rest and sleep. where real recovery happens. Muscles do not get stronger during exercise. They get stronger during rest. Lack of sleep reduces recovery hormones, increases inflammation, weakens muscles more quickly. Aim for 7 to 8 hours of sleep, avoiding long periods of late nights, relaxing the body before bedtime. This is often the most ignored part, yet it has the strongest impact on muscle recovery after 50. Why do these methods work? Because they restore the correct role of the glute muscles. When the glutes do their job, the back does not have to strain. The knees are not overloaded. Natural, confident walking returns. This is not a trick. It is basic movement physiology. If you would like me to create detailed step-by-step guidance for each exercise, including common mistakes to avoid, follow the channel and leave the number 1 in the comments below. Next, I will summarize everything and show you how to maintain these results long-term, so this strength not only returns, but stays with you for many years to come. Before we finish, I would like you to pause for a few seconds. Not to memorize research numbers. Not to worry and ask, is it too late to start now? But to understand one very important thing. Your body is not betraying you as you get older. It is simply reflecting how it has been used over many years. Today, we have clarified a fundamental medical truth. After the age of 50, the biggest problem is not that you are becoming weak, but that the most important muscle groups are no longer being called on to work when they should. 5 key points to remember. First, walking is good, but walking alone is not enough. Walking keeps you moving, but it does not create enough strength to keep the glute muscle strong. If you only walk, your body is working at a minimum survival level, not a protective level. Second, the glute muscles are the foundation of movement. When the glute muscles are weak, the lower back works too hard. The knees take uneven pressure. Your walking pattern changes, and the risk of falling increases quietly, without warning. Third, back pain, shaky legs, and difficulty standing up are not your fate because of old age. They are signs that the body lacks proper support, not that it is broken beyond repair. Fourth, the body after 50 can still learn very well. With the right exercises and the right amount, the glute muscles can be reactivated, and the nervous system can relearn how to move correctly. Fifth, strength after 50 does not come from pushing harder. It comes from consistency, accuracy, and respecting your body. A short scientific message. Muscles do not disappear because of age. They disappear because they are no longer asked to work. When you give your body the right signal, muscles respond. Balance improves. Pain gradually reduces. Confidence in movement returns. Not after many years, but often within weeks to a few months. So what should you do now? You do not need to train heavily, compare yourself to others, or try to get your youth back. You only need to choose 1 or 2 glute exercises. Practice 2 to 3 times per week. Combine this with enough sleep and proper meals. Do less, but do it correctly. If you would like me to go deeper into each exercise, explain common mistakes, and guide you through a safe plan for people over 50, please follow and subscribe to the Dr. James Anderson channel, and leave the number 1 in the comments. Before you go, I want to leave you with one final, gentle reminder. Health is not found in a medicine cabinet. It is built into your daily habits. Thank you for taking time today to care for your body. You do not need to move faster. You only need to keep going.